Now, here you can see two blood vessels. If you were saying that the one on the right is very diseased, that is correct. You can see that small opening. And you're probably saying that when that small opening closes off, there'll probably be a heart attack. But interestingly enough, no. Only about 10% of heart attacks come from something that looks this nasty. Yes, that patient is going to have angina and chest pain and shortness of breath. But this is such a slow developing blockage over many decades. Very often the body will make its own bypass. These little tiny threads, these little threads of blood vessels will develop that go around this blockage so that when that tiny opening finally closes off, there will be enough blood supply from these small little collaterals to sustain the downstream viability of the heart muscle. Now, I want you to look for a moment at the left. That is a normal artery, and you're looking at the, even those of you in the back of the room, that tiny little lining of dark cells, the innermost part of the artery is called the endothelium. And that's one of two words that I want you to remember after this presentation tonight. So, that's the endothelium. And each cell is an endothelial cell. And that has a remarkable function that we're going to talk about in a moment. But one of the first things that happens when you are eating that milkshake, the cheeseburger, the pizza, what happens is those cellular elements within your bloodstream begin to get sticky, sticky, sticky. The endothelium gets sticky. Your platelets, your clotting factors get sticky. Your LDL cholesterol gets sticky. Now let's do this. Let's take a look at a slide from Peter Libby from Harvard. Now, even though I went to Yale, this is perfectly fine. We like to see what Harvard has to say. Just to get you oriented here, the blue is where the blood is flowing. And then you can see those tiny little purple cells will separate the flowing blood from the wall of the artery. Those again are the endothelial cells. Now let's make sense of this slide together and go to the upper left. There in the upper left, you see these orange LDL cholesterol particles, which are now sticky because of what you've been eating. They rub up against the sticky endothelium and they find a crack, a fissure, or an opening, and they migrate into the subendothelial space, whereupon they are promptly oxidized by these free radicals that we've been eating. And the subendothelial space does not like these small, hard, dense LDL cholesterol particles, and it calls upon our SWAT team to come across and deal with that. And here the SWAT team is demonstrated by Peter Libby of Harvard. He has painted the white blood cells blue in honor of Yale, and we like that. So now you see this blue SWAT cell coming across, going across, gobbling up like Pac-Man, these small, hard, dense, oxidized LDL cholesterol particles until it gets all the way over here to the right, where now it's absolutely chock full. And we in medicine do what we do so often, we change the name. That is now called the foam cell. And the foam cell is truly the Darth Vader of this sequence of events. Why? Because the foam cell elaborates, manufactures, produces these nasty metalloproteinases called stromelicin, elastase, collagenase, myeloperoxidase. What do they do that's so bad? They progressively, these metalloproteinases produced by the foam cell, progressively thin out the cap over the plaque. So let's now look at the figure on the far left. You can see at the top of the plaque that little white cap now has suddenly got a crack in it. Because of these metalloproteinases thinning out the cap over the plaque, the sheer force of blood racing over it tears it. Now suddenly you have a rupture of the cap over your plaque. There is now the extravasation of, or the oozing out of, if you will, of plaque content into the flowing blood, which activates our clotting factors like platelets. And suddenly a clot forms. As we go to the middle figure B, you can see the clot forming. And the clot is in and of itself self-propagating. So in a matter of further minutes, we go from the middle figure all the way over to the right. And now what do you see? The clot has completely blocked the entire artery. All the downstream heart muscle has now been deprived of its oxygen and nutrients. That, ladies and gentlemen, is 90% of your heart attacks. Now, if I do my job correctly this evening, hopefully every one of you and your friends and relatives will make themselves heart attack proof. How are you going to do that? You're going to make yourself heart attack proof by changing your biochemistry. We're going to change your biochemistry because we're going to ask you to change to whole food, plant-based nutrition. When you do this, this entire sequence of events that I have just described to you will be halted. You will not have your LDL cholesterol be sticky. It will not migrate into the subendothelial space. It will not be oxidized. You will not have the SWAT team come on. You'll not have the formation of the foam cell. If you do not have the formation of the foam cell, you will not be able to weaken or thin out the cap over your plaque. As a matter of fact, eating plant-based, you will strengthen the cap over the plaque. If you strengthen the cap over your plaque, it cannot rupture. And if it cannot rupture, you have now made yourself heart attack proof, and we think you can do that in about 3 weeks.